It is biologically impossible to get pregnant without sexual intercourse, as pregnancy occurs when a sperm fertilizes an egg in the female reproductive system. However, there are several alternative ways to achieve pregnancy without traditional sexual intercourse. In this article, we will explore the different methods of getting pregnant without sex, including artificial insemination, in vitro fertilization, and surrogacy. Artificial insemination. 1. Artificial insemination is a process where sperm is introduced into the female reproductive system via a medical procedure. There are two main types of artificial insemination. Intrauterine insemination, IUI. In this method, sperm is directly injected into the uterus through the cervix using a thin tube. This procedure is usually performed when there is a low sperm count, difficulty in sperm motility, or for women with ovulation issues. The sperm used in IUI may come from the partner or a sperm donor. Intracervical insemination, ICI. This method is similar to IUI, but the sperm is deposited in the cervix instead of the uterus. ICI is a less invasive method and is often used when fertility issues are not severe. Artificial insemination is a relatively simple and low-cost procedure, but the success rate varies depending on the cause of infertility and the age of the female partner. In vitro fertilization, IVF. 2. In vitro fertilization is a more complex procedure that involves fertilizing an egg with sperm outside the body in a laboratory. The fertilized egg, embryo, is then transferred to the female partner's uterus. IVF is often recommended for couples who have been trying to conceive for a long time or have fertility issues. The IVF procedure involves several steps, including stimulation of ovaries. The female partner is given hormones to stimulate the ovaries to produce multiple eggs. Retrieval of eggs. The eggs are retrieved from the ovaries using a small needle. Fertilization. The eggs are mixed with sperm in a laboratory dish to facilitate fertilization. Embryo transfer. The fertilized eggs, embryos, are transferred to the female partner's uterus. IVF is an expensive procedure, and the success rate varies, depending on the age of the female partner and the cause of infertility. Surrogacy. 3. Surrogacy is a process where another woman carries and delivers a child for a couple or an individual. There are two types of surrogacy. Traditional surrogacy. In traditional surrogacy, the surrogate mother's egg is fertilized with the intended father's sperm or a sperm donor's sperm using artificial insemination. Gestational surrogacy. In gestational surrogacy, the surrogate mother carries the fertilized egg, embryo, of the intended parents, which is created through IVF. Surrogacy is a complex process and requires the help of a fertility clinic or surrogacy agency. It is an expensive procedure, and the laws surrounding surrogacy vary depending on the country or state. Conclusion. Getting pregnant without sex is possible through alternative methods such as artificial insemination, in vitro fertilization, and surrogacy. However, these methods are often complex and expensive, and it is important to seek the advice of a medical professional before pursuing any of these options. While there may be various reasons why a couple may consider these options, it is important to note that traditional sexual intercourse is the most natural way to conceive a child.